Forensic nursing is a unique specialization within the nursing profession. It focuses on the intersection of healthcare and the legal system. Forensic nurses provide care for individuals who have experienced violence, trauma, or criminal activity. They are also responsible for collecting and preserving evidence, providing expert testimony in court, and advocating for the rights of victims. Forensic nursing emerged as a response to the need for specialized care for victims of violence. Traditional healthcare systems were not equipped to address the unique medical and legal needs of this patient population. As violence and crime rates remain a concern, the demand for skilled forensic nurses continues to grow. These professionals play a vital role in ensuring that victims receive the care and justice they deserve. The roots of forensic nursing can be traced back to the late 20th century. A growing awareness of the prevalence of violence, particularly against women and children, highlighted the need for specialized care for victims. In the 1970s and 1980s, pioneering nurses began to recognize these shortcomings and advocate for change. The concept of forensic nursing first emerged in the early 1990s. The term itself was coined by Virginia Lynch, an influential figure in the creation of the specialty. Lynch, alongside others like Janet Barber Duvall, played a critical role in defining the field and outlining its scope. A nurse with a background in emergency care, Virginia Lynch recognized the need for specialized care for victims of sexual assault. In 1992, Virginia Lynch, along with other like-minded professionals, founded the International Association of Forensic Nurses, or IAFN. The establishment of the IAFN marked a turning point in the development of forensic nursing globally. Forensic nursing has grown to include various roles beyond the sexual assault nurse examiner. These roles include forensic clinical nurse specialists, forensic nurse investigators, legal nurse consultants, and more. Nurses in these roles may work in hospital settings, community anti-violence programs, coroners and medical examiners' offices, and psychiatric units. Over time, the field gained legal recognition, and certification processes were established to ensure competency in forensic practices. The certification offered by the IAFN became a credential that attested to the specialized knowledge and skills of nurses in this field. Forensic nursing is a diverse field with a wide range of roles and responsibilities. They work in hospitals, clinics, coroner's offices, and law enforcement agencies. Roles include sexual assault nurse examiner, or SANE. This is perhaps the most recognized role within forensic nursing. SANEs are registered nurses who have completed specialized education and clinical preparation in the medical forensic care of a patient who has experienced sexual assault or abuse. They are responsible for conducting forensic examinations, which may include collecting and preserving evidence, providing expert testimony in court, and offering compassionate care to survivors. Forensic nurse investigators or examiners work in the medical examiner's or coroner's office. They may also be called death investigators. They assist in the investigation of deaths, particularly those that are unexpected, violent, or unexplained. Their role includes examining the body, collecting medical and other evidence, and documenting findings for autopsies or judicial proceedings. Legal nurse consultant, or LNCs, use their healthcare knowledge in conjunction with legal expertise to consult in medical, legal cases, or litigation. They might work for legal entities or independently, reviewing patient records to determine the standard of care. Their work include interpreting medical terminology and healthcare issues to provide a clear understanding to legal teams, or acting as expert witnesses. Forensic psychiatric nurses work with patients within the criminal justice system who are also receiving psychiatric care. This can include those who have been found not guilty by reason of insanity, those undergoing assessments of their fitness to stand trial, or those who need treatment for mental health issues while incarcerated. Domestic violence nurse examiners. Similar to SANEs, These nurses specialize in caring for victims of domestic violence. They are trained to identify signs of physical abuse, document injuries, collect evidence, and provide support and referrals to ongoing care and services. Forensic gerontology specialists focus on the care and needs of the elderly, particularly in cases involving abuse, neglect, or exploitation. They work closely with legal teams and social services to protect vulnerable older adults and ensure they receive proper care. Correctional nursing specialists work within correctional facilities, providing care to inmates and detainees. They are trained to handle the unique challenges of the correctional environment, including substance withdrawal, mental health issues, and injuries from violence or self-harm. The scope of forensic nursing practice is as diverse as the field itself. The scope and standards of practice for forensic nursing define the professional expectations and responsibilities of nurses in this field, ensuring they provide competent and ethical care while interacting with the legal aspects of healthcare. Forensic nurses provide direct care to patients who are victims of trauma, violence, criminal activities, and accidents. This care extends to both physical and psychological aspects, ensuring comprehensive support for recovery. One of the key aspects of forensic nursing is the collection, preservation, and documentation of evidence. This includes following strict protocols to maintain chain of custody, which is crucial for the admissibility of evidence in court. Forensic nurses often interact with legal professionals, providing expert testimony in court cases and working with law enforcement to report findings that may influence the outcomes of legal proceedings. They play a significant role in educating the community, patients, and other healthcare providers about preventive measures against violence and injury. Forensic nurses engage in research to improve the practice and develop new techniques for better evidence collection and patient care. They contribute to the development and revision of policies related to health and legal systems, aiming to enhance the standards of care and legal responses to violence and trauma. Forensic nurses are trained to recognize the signs and symptoms of trauma and to provide trauma-informed care that is sensitive to the unique needs of each individual. Standards of forensic nursing practice. To ensure consistent, high-quality care, forensic nursing practice is guided by a set of established standards. These standards, often developed by professional organizations like the International Association of Forensic Nurses, address key aspects of patient care, evidence handling, ethical conduct, and professional development. Standard 1. Assessment. Forensic nurses conduct thorough assessments that consider physical, psychological, and circumstantial factors. This involves not only medical evaluation but also meticulous documentation of injuries and the collection of forensic evidence. Standard 2. Diagnosis. Based on the assessment, forensic nurses identify health problems that require immediate and appropriate interventions. Standard 3. Outcomes identification. Forensic nurses define specific, measurable goals tailored to each patient's situation, considering both health recovery and legal processes. Standard 4. Planning. This involves creating a detailed care plan that addresses both the immediate health needs and the forensic requirements of the patient. Plans are comprehensive and interdisciplinary. Standard 5. Implementation. Forensic nurses implement the care plan, which can involve medical treatment, evidence collection, and collaboration with other professionals. Standard 6. Evaluation. Forensic nurses continuously evaluate the effectiveness of the care and adjust the plan as necessary. This includes monitoring the patient's healing and the impact of any legal proceedings on their well-being. Standard 7. Ethics. Forensic nurses adhere strictly to ethical guidelines respecting patient confidentiality, informed consent, and the rights of all individuals involved. Example: ensuring that a patient fully understands their rights during a forensic exam and maintaining confidentiality in sensitive cases. Standard 8. Education. Forensic nurses commit to lifelong learning to stay updated with the latest in clinical practice and forensic science. They also educate their patients, families, and communities about forensic health issues. Standard 9, evidence-based practice and research. Forensic nurses integrate the latest research into practice and may participate in research to improve forensic nursing care. Example, using the newest evidence-based protocol for collecting DNA to ensure the highest quality samples are obtained and preserved. Standard 10, quality of practice. Forensic nurses strive to improve their practice continuously and contribute to the overall quality of the forensic nursing profession. Example, participating in peer review sessions and providing feedback to improve clinical guidelines. Standard 11, communication. Effective communication is essential, especially as forensic nurses often act as a liaison between the healthcare and legal fields. Example, clearly documenting findings in a manner understandable to law enforcement and legal professionals. Standard 12, leadership. Forensic nurses are often in positions where they need to advocate for patient care, influence policies, and lead change in institutions. Example, leading a hospital task force to implement standardized protocols for dealing with victims of human trafficking. Standard 13, collaboration. Forensic nurses work closely with professionals from healthcare, law enforcement, legal, and social services to provide comprehensive care. Standard 14, professional practice evaluation. Forensic nurses evaluate their performance and seek feedback to improve their practice continually. Example, engaging in reflective practice sessions and seeking mentorship to enhance skills in forensic evidence collection. Current trends and future of forensic nursing. The field of forensic nursing is constantly evolving in response to societal changes, advancements in technology, and a growing understanding of the impact of violence and trauma. One significant trend is the increasing recognition of the prevalence and impact of trauma. Trauma-informed care, which recognizes the pervasive effects of trauma and seeks to avoid re-traumatization, is becoming increasingly integrated into forensic nursing practice. Technological advancements are also transforming the field. New DNA analysis techniques, for example, are leading to more accurate and efficient identification of suspects and victims. Forensic nurses are increasingly using electronic medical records, or EMRs, to document injuries, collect evidence, and track patient outcomes. The opioid epidemic and the growing mental health crisis are also impacting forensic nursing practice. Forensic nurses are increasingly encountering individuals with substance use disorders and mental health conditions who are involved in the legal system. Another trend is the growing emphasis on interprofessional collaboration. The vital role of forensic nursing. Forensic nursing stands as a testament to the evolving nature of healthcare, responding to the unique needs of individuals impacted by violence, trauma, and crime. From its humble beginnings, marked by significant contributions from pioneers like Virginia Lynch and Janet Barber Duvall, whose foresight and dedication have established forensic nursing as an indispensable field within modern healthcare and criminal justice systems, to its current standing as a recognized specialty, forensic nursing has played a vital role in bridging the gap between healthcare and the legal system. Forensic nurses' unwavering commitment to justice, compassion, and evidence-based practice will continue to shape the landscape of healthcare and contribute to a safer and more equitable society. In conclusion, forensic nursing is not merely a profession, it is a calling.